example, you could have mood swings in substance use disorders, but you can also have mood swings in bipolar disorder. So that it's the fact is that we often share symptoms across different diagnostic categories, so that the idea that everything is kind of mutually exclusive makes it important that when you're looking at the diagnosis of any one particular person, you're not just trying to put a label on them, you're really trying to understand how their signs and symptoms contribute to their total well-being, because people are heterogeneous and there's lots of differences between people. Somebody may have a substance use disorder, but if they're a 65-year-old social drinker who was forced to retire and then gets into more of addiction problems after retirement, that's still substance use disorder, but there's quite a bit of difference between a 20-year-old whose family history is riddled with addiction, whose role models are all that you cope with life by drinking and drugging, and who at 20 has had a pretty 5-year history of severe addiction. Both of them have addiction and substance use disorder, but they're heterogeneous in terms of their clinical presentation and their clinical needs. Now, in the diagnostic criteria for DSM-5, it's important to remember that diagnosis is important, but it's still based on clinical judgment. And so in the DSM-5, they give you a chance to be a bit more specific about the different types of diagnoses. You're not just the walking label of your diagnosis. There are subtypes and specifiers that you can add. There are severity specifiers that can give you a sense about how is it for this particular person, and also course specifiers. Is this somebody with a chronic course or a short-lived course of illness? There are descriptive features that will help expand out and give a more individualized perspective. Is this a person with good insight? Is this a person in a controlled environment? Is this a person who's in partial remission or in full remission, or is this somebody who's having a recurrence of their disorder? And so when you're doing a diagnosis, this is really a combination of a clinical interview with checking the criteria at DSM-5, but above all looking at this in terms of the clinical judgment way. Now, just a bit more on the subtypes and specifiers. You're trying to make the diagnosis at this current time based on their